Good morning, everybody. My name is Adonia Simpson, and I direct the Family Defense Program, and thank you so much for joining our webinar today. A couple of housekeeping rules. Please make sure that you have muted yourself. Extremely important, so our speakers are heard clearly. Next, this webinar is being recorded, and we will share the recording afterwards along with the slides. So if you have to jump off or somebody that you know would be interested in the webinar, please make sure to share that link when available. Also, I want to draw everybody's attention to the chat box. You should be able to access the chat box, and as we go along, if you have any questions, please feel free to chat them there. We'll be monitoring, and if it's appropriate to answer during that time, we will go ahead and address them, or we may save them to the end depending on the questions. So please make this interactive, use the chat box. I want to thank our speakers today. Sylvia Delgado, she'll be providing some background on the access to medical care issues, and Indira Demeen, fantastic immigration attorney, who's going to be providing information about some of the updates of agencies and what some of this new legislation means for immigrants. Again, my name's Adonia, and I will also be jumping in here and there with information. And I recently heard an advocate say that the virus does not discriminate based on immigration status. However, a lot of the efforts that we've seen to address the COVID-19 issue really do leave many of the most vulnerable, particularly immigrants, out in the cold. So some of the goals of today's presentation, all right, next slide, is to provide you all with information about what's happening with various immigration agencies, what immigrants may be eligible for relief benefits and who's left out, where there might be some movement for future, and I'm sorry the slide cut off the information, where there might be some space for advocacy to make some changes down the road, and where immigrants can go to receive help. So without further ado, I want to go ahead and pass it along to Indira.
Good morning, guys. My name is Indira. Like Adonia said, I'm a local immigration attorney here in Southwest Florida. There have been some updates from USCIS. USCIS is the office where a person would file an immigration form or application to. They have suspended all in-person appointments, and I see we have a chat. Now, so if you had an appointment scheduled later in March or April, you've probably got a notice from USCIS canceling your appointment and letting you know that it will be rescheduled in the future. We're not sure when. So also biometrics appointments. So folks that have a pending application would usually go in for fingerprints. That has also been canceled. If USCIS had your fingerprints already on file, what they will do is reuse those fingerprints and just update it. That way they're limiting the number of folks that have to come in and get their fingerprints done. Also, there's something called a request for additional evidence, notice of intent to deny. These are things with deadlines that come from USCIS that says, okay, you have by April 30th to respond with this additional piece of evidence. Now, USCIS has announced flexibility, an extension of those requests for additional evidence, understanding that during this time, folks are limited in getting that additional piece of evidence or responding in a timely manner. So we are seeing some flexibility from USCIS, and again, cancellation of all in-person appointments. Next slide, please. Okay, so I've been getting a lot of calls about this, so I do want to address this. A lot of folks, especially here in Southwest Florida, we are a spot for foreign travelers to visit, and a lot of folks are stuck, here in Florida and unable to return to their country. However, their visa in the United States is temporary. So, for example, if you are someone on a visitor's visa, you're allowed up to 6 months at a time. And what if your 6 months is expiring? What do you do? What if you're here from a country that doesn't, you don't need a visa to enter the United States? You're here on a visa waiver and you're allowed to stay up to 90 days at a time. But unfortunately, because of COVID-19, you're unable to leave the United States. What happens to those folks? I'm getting a lot of calls from people just not wanting to fall out of status. If you're here on a temporary visa, there is a form you can file to extend your temporary status. And we've listed the form here on the slides, and you will have access to it afterwards to go through it. The form is also available online for folks to file online, and it's on the USCIS.gov website. You can log in there and file for an extension of your visitor's visa or a temporary visa that you may be on. Keep in mind that USCIS has announced that there is a backlog in these forms, so you probably won't get a response to your extension right away. But the good news is USCIS is showing flexibility with these forms. So the idea is just to try to get it in as soon as possible. So if you know your 6 month stay is going to expire, April 30th, probably file it now. Even if you don't get an answer by April 30th, you've already filed your extension, so you can at least breathe a little easier that you haven't violated your visa. Now, with folks that are here without a visa and on a visa waiver, they are not eligible to file this extension because, again, they're not on an actual visa. But they may request something called a satisfactory departure from USCIS for up to 30 days. And we're being told that if in 30 days they're still not able to leave, they can request another 30 days extension. And I do have the contact information of how you can go about requesting that. And we can provide it to you if that's something that you folks want. Next slide, please. If you're unable to file for an extension, so what I previously talked about, and you're filing late, USCIS has announced that they will take that into account, that we're in, this uncharted territory here. COVID-19 is not something we've ever seen before, so they are going to accept late filing in their discretion. So if you can submit evidence showing, I was supposed to leave by March 30th. I was unable to file my extension in time because I was sick, because a family member was sick. I was unable to do so because of financial reason. Whatever the reason may be, if you're able to document it, I would still encourage folks to file that extension, even if it's late, because you don't want to anyway jeopardize your immigration status in the future. So they are accepting late filings. Next slide, please.
All right, so I'm going to go ahead and jump in here and talk about the immigration court system. I'm listing a website here with the PowerPoint that we share. These are all clickable links, so you can go and get more information. So in regards to the immigration court, which is, there's one in Miami and there's one in Orlando. Nationally, anybody who's not detained, all hearings through May 1st will be rescheduled. So if people have a master calendar, which is just a general hearing, or an individual, which is a merits hearing, those will be rescheduled. There's a very good chance that that this may be continued. So we're still waiting for information from EOIR. However, just a point that people should note in this regard, a lot of the notifications that we receive regarding closures of the courts are received the night before a closure, and oftentimes advised via tweet. So if information about court closures is extremely important to you, I recommend following DOJ EOIR on Twitter to get the most up-to-date information. You can now e-file, and this is not just for attorneys, but also for respondents. If they want to file documentation in their case, there's information online about how you can file this information via email. There's also options to file information by mail. In regards to detained cases, there are individuals detained at Broward Transitional Center in Broward, at Crome Detention Facility, and also at Glades. Those are the main detention facilities in our area that hear immigration cases. As of right now, I say business as usual, but it's been a bit crazy. Attorneys do have to wear and bring their own personal protective equipment. Most attorneys, both on both sides of the government and of the respondent, are actually appearing via telephone. And even some of the respondents, because of concerns of some outbreaks in the facilities, the respondents are even sometimes appearing via video teleconferencing. So make sure you're just keeping an eye on this website for any extensions of closures. So if a case has been rescheduled, you do not need to go, and you will just need to make sure that you receive notification as to when you need to go in the future. There's options to call an 800 number to see if the case has been rescheduled as well. All right, another update. A lot of people have to do check-ins with ICE. This is where maybe somebody has a final order of removal, or perhaps they're in removal proceedings and they have to periodically go into ICE and check in. For Miramar, they're rescheduling on a case-by-case basis, which has been difficult because they're not doing a blanket closure and telling people that they're going to reschedule. But we do advise people, if you have to go to ICE Miramar in the coming weeks, you should email this email address or call and ask that your case be rescheduled to a future date. Orlando, however, has closed to check-ins across the board, so anybody in this time, it will be rescheduling. Miramar ICE has not told us how long the rescheduling period will be. So my recommendation is anybody that has anything in the next few weeks to go ahead and affirmatively ask that the case be rescheduled. The ICE offices will continue to accept postings of bonds in person, which is really important because we have a lot of people that are still detained that are trying to get released on bonds from ICE or bonds from the immigration judge. So there really does need to be a mechanism to go in and post those bonds so that people can be released. Also, ICE is still accepting stays of removal, and those have to be filed via mail. And a stay would be something that would prevent somebody from being imminently deported. And as you may have all seen on the news, there's been a lot of press coverage that deportations are continuing. We've had several deportations to Haiti, and then one most notably this week to Guatemala. All right, Indira?
Yeah, so, and we were just talking about this before you guys got on, that, and what Jonia just talked about folks being deported recently to Guatemala, and I believe you said about 20 of them tested or for COVID-19?
44.
Oh, 44 tested positive for COVID-19. So just an update from the Department of State, President Trump issued a memo directing the Department of State to impose visa sanctions on any foreign country that denies or delays acceptance of its citizens. So what does that mean? It means that we're still moving forward with deportation and in regards to whether or not the person has tested positive or not. So just a little update for you.
All right. So many of you may have heard of the new public charge rule that it was up for notice and comment starting a couple years ago. It was supposed to go into effect October of last year, but there was a lot of appeals and litigation. However, the public charge rule for inadmissibility did go into effect earlier this year. And I think it's really important. There's a lot of misinformation, there's a lot of fear. It's important to note that public charge and admissibility only applies to a small portion of applicants who are looking to get their green cards or just status or looking for admission into the United States. So what does that mean? Certain individuals that are maybe survivors of domestic violence or asylees or refugees, a lot of those individuals who are applying to get their green card are exempt from this public charge and admissibility. And there's only certain types of benefits that are being taken into consideration as far as whether somebody would be found inadmissible for public charge. So the most important thing to note about public charge, and is so important for messaging in our immigrant communities, is that USCIS has made abundantly clear that any sort of benefits for testing or treatment related to COVID-19 will not be considered in regards to a public charge and admissibility determination. People should not be afraid to seek help. They should not unenroll their children who are eligible for benefits from Medicaid, or whatever benefits they may receive, because these will not be factored into a public charge and admissibility determination. Also, it's important to note we are thinking of arguments about reduction in hours or loss of jobs, financial difficulties that are related to COVID-19, how we can explain this in regards to a public charge argument as far as why somebody is not a public charge. Also important to note, and we're going to probably hit this again a little bit later on, is any sort of stimulus payment is considered a tax credit, so it's not taken into consideration for the public charge regulation. And also a lot of the other benefits that we've been seeing are explicitly, like unemployment insurance. These are explicitly not taken into consideration as they are an earned benefit. So most important takeaway, please encourage people to get the help for themselves and their families if needed, because this is a public health emergency. All right, Indira, do you want to take part 1 of the CARES Act?
Unmute. Sure. So for regular unemployment benefits, this is the one we're on, right, Adania? Did I miss one? Yeah.
Yes, ma'am. Or did you want me? Go ahead.
You can go ahead and do this one. I'll do the next one.
Okay, so the CARES Act has been amazing for a lot of individuals in the country, a lot of people experiencing job loss. There's been a lot of great expansions, but like I mentioned at the beginning of this webinar, there's a distinct group of the population that's being left out. So first and foremost, it's really important to note that there is no expansion on Medicaid benefits or SNAP eligibility for immigrants. So you have to be a qualified immigrant to get those benefits before, and you still have to be a qualified immigrant to get those benefits now. So qualified immigrants includes lawful permanent residents of more than 5 years, asylees, refugees, survivors of domestic violence. There's a very limited group of immigrants that are actually eligible for benefits to begin with. And as I said, there's no expansion on eligibility for immigrants under the CARES Act. Also, in regards to unemployment benefits, immigrants generally must be work authorized at the time that they file. They have to be work authorized during the base period and be work authorized during the entire period that they are receiving benefits. So what does this mean? This means individuals with temporary protected status, TPS, or individuals with DACA, Deferred Action for Childhood Arrivals, they would be eligible for unemployment benefits, as well as the expanded benefits under the CARES Act, which includes an additional $600 a week, an extension of 13 weeks of benefits. So if somebody is work authorized during the period, they should seek these benefits out. It's really to support vulnerable families. So the big issue where there's been so many questions, and an issue that I have a lot of concern for, is when it comes to the rebate relief checks that will be issued, an immigrant must have a social security number to qualify for the payment. What is really unfortunate, the way that it stands at this time, is that if anybody in the household uses either an ITIN, a tax ID number, or does not have a social security number, the entire household is going to be excluded from receiving the benefit. So for example, you have somebody that's a US citizen and maybe married to somebody who's undocumented, and they've been filing their taxes with the undocumented spouse using an ITIN, and they have a couple of US citizen children. Because of this, because of the undocumented spouse not having a social security number, the whole family will be disqualified. And I wanted to just read a fact for you from Unidos. They said that this restriction will bar access to the $500 credit for children to at least 5.1 million US citizen or non-US citizen children who have social security numbers. So that number is staggering. There's a lot of families that are really in need of this benefit that will be excluded. Oh, I'm sorry, I jumped to the wrong slide. All right. Indira, do you want to go over what benefits people, if they are eligible, can receive?
Yes, I can. And I see that we have a message in the chat box and we can address that right after this. So um, the $500 tax credit will be paid for US born children as long as they're under the age of 17 and being claimed by someone who has a valid Social Security authorizing work. If you can either be married filing single or married filing jointly. If you're married filing jointly with another individual, they must have a Social Security authorizing work. The only exception is that if the one spouse has a Social Security and the other one doesn't, if one of the spouses is a member of the U.S. Armed Forces, then they will be eligible. What does that mean? This means that if there is a married couple, one that is authorized to work, the other that is undocumented, that household would be ineligible. So this does, like Adonia said earlier, this does disqualify many households and many family members that would otherwise take advantage of this benefit. So just take a look at this. Yep.
All right. And I'm going to go ahead and jump in and answer the question from Patricia. This is a great question, and I apologize. It was me not being extremely clear. The question is, can you provide the site on how victims of domestic violence are exempt as eligible immigrants? Specifically, it's survivors of domestic violence who have an approved I-360 visa petition. Those are individuals that are able to access and are qualified immigrants. And I thank you for asking this question because I wasn't extremely clear. I was very vague, but you have to have this approved visa petition or a prima facie decision from USCIS to be a qualified immigrant. So Patricia, I hope that answers your question. All right, Indira, do you want to go ahead and talk a little bit? Southwest Florida has a lot of rural communities with people in the farming industry or housekeepers. Can you talk a little bit about that?
Yeah, so this is, again, questions about this. Must have a valid Social Security for work, and they must meet the income parameters that we just mentioned above. So nothing specifically, no specific benefits for farm workers or housekeepers, but and I don't even add it in here. Folks are still able to access WIC, food pantries, Meals on Wheels, school lunches, and those sort of programs that are available. So we do encourage you to share that with the community and make sure that folks, that farm workers, housekeepers that fall into this without any additional benefits or without any additional help can take advantage of these community programs that are available.
All right. I wanted to talk a little bit about enforcement. In the CARES Act, there's actually some provisions regarding ICE enforcement specifically. So first of all, the CARES Act has no new funding for ICE, which is great news. It also explicitly prohibits any transfer of funds for enforcement purposes of ICE or transfer funds to the building of the wall. So the CARES Act was really great in focusing, ensuring that the benefits and the relief are really going towards the treatment of COVID-19 and not being repurposed for other enforcement issues. Also, ICE has issued guidance, which this wasn't surprising. There was previous memos and information about what sort of places ICE would or would not generally go to without exigent circumstances. But ICE formally provided guidance that they would not be doing any enforcement near or at healthcare facilities. So please make sure that individuals know that if they need help, they should go and seek the help. And the last thing that they should be concerned about is any sort of enforcement by ICE. All right. Sylvia, we are flying through this. I thought we were going to be getting a lot more questions. We did have a question from Ahmed about the slides. Yes, as mentioned, we will be sharing these slides afterwards along with the recording. So thank you so much. So Sylvia, are you ready to jump in? Feel free to take yourself off mute.
I am. Hi. Thank you. Well, that was a lot of good information, especially for our community. My name is Sylvia, and as Adonia had already previously introduced us, I am the Director of Social Services for Family Health Centers of Southwest Florida. And part of what I am going to present is the access to healthcare specifically for immigrants, but I do like to add that these services is available for all of our patients here in Southwest Florida. And so the first thing that I'd like to inform is that there is a temporary policy addendum. So we have a sliding fee scale here at Family Health Centers. So as a result of the ongoing COVID pandemic, Family Health Centers has implemented an emergency process. This will allow the community members to utilize a self-declaration. And what is that? The self-declaration means that for anyone that has lost their job due to this crisis can come in and self-declarate. We have, our staff is trained and to complete a worksheet, and according to what they tell us, they'll self-declarate their income. This is good for 30 days and will continue to be utilized until the emergency crisis ends. And even after that, at the end of the 30 days, they can come in and renew their sliding fee scale. This is a big help because in my experience, the individuals here in Southwest Florida that are uninsured, they have a place to come and receive medical attention. Please let everyone know that if they need medical attention, we are here. We're set up to take care of their medical needs. I think the next service also available, I have received a lot of calls and the families are afraid to come out. They're staying home. They're following what has been on the news, the distancing and staying home, keeping safe. And so Family Health Centers is also offering telehealth services, both to our Medicaid and to our non-insured pediatric patients. Our providers are set up to do these video consults with patients. Those, of course, those that can be handled remotely. Patients do need to have a smartphone, and we have 3 devices. They can do it through WhatsApp, FaceTime, or Skype. These services are available in bilingual, Spanish and English. So patients, if you have anyone out there that needs medical services and are interested in these video consults, please refer them to our call center. And I did provide the website and the number. It's 844-FHC-SWFL. So please let them know that we're here to serve them. And as far as for dental services with Family Health Centers, at this time, Family Health Centers is providing emergency services only. As for the testing, I would, and it's on the website, I'm not a medical provider or clinical, so I don't want to give out any information that might confuse the individuals, but I do. I did go into the Florida Department of Health website, and they direct also to the CDC guidelines. Please become educated of what's out there and what to do. Sometimes we can be better prepared if we go out there, even as fearful as it is. These websites do provide very good information, very simple, that we can teach our children as well to be safe. So I invite the community to share these websites and be safe out there. I also wanted to, if you want to change the slide, if you don't mind, I wanted to, as working out in the community, you spoke a little bit about what what the community and immigrants are eligible and not eligible for. And as I was hearing the information being provided with a lot of families not being able to take advantage of the services that are going to be available, a lot of the families do need to tap into the community services, such as the food pantries and other resources that they can tap into. And I want to, I set the 211 helpline. If you go into that into the 211 24-hour line, they also provide the listing of all the food pantries available in the community. Churches are also jumping into and even delivering, so that is also available. I have also received many phone calls where patients that have been diagnosed with depression, anxiety, and other mental illnesses, the resources that are available, they're open 24 hours, 7 days a week. There's a number available. Please utilize that service. It's there for the community, and it's there for everyone. It is bilingual, so tap into that information as well. As for the filing unemployment and reemployment, the website is there. It's quite difficult. We've had many calls that from our community that it's difficult for them to actually navigate the system. So if they can definitely call and get assistance by phone, and hopefully we can walk them through the process. And also for the Florida Department of Education, a lot of parents want to know what's going on. So there's a link also available for the parents and the families that want to know what's going on with the schools opening, closing, and the most updated information. And I think that's about it. Thank you. If there's any questions, I'm available.
Awesome. Thank you, Sylvia. That's a lot of fantastic information. I wanted to share one more fact and figure with you guys, since we're actually running ahead of schedule. When does that ever happen? I think you can tell from the information presented, there's a lot of holes and there's a lot of areas where there really needs to be some advocacy on any future legislation. We were talking earlier that there's some states that have been filling in those gaps on the statewide level. So perhaps, for example, California, New Mexico, New Jersey, they've been doing things that have expanded Medicaid access to immigrants in certain ways on a state level, also expanding unemployment benefits on a state level and making access for other things. But as you can see, there's still a lot of holes on the federal level that really need to be addressed for our most vulnerable populations. So here's a figure for you, and this is from the Center for Migration Studies. So ITIN filers, those are individuals that have a tax ID number that don't necessarily have a social security number. These are the people that are oftentimes going to be, these are the people that are not going to be able to receive the tax rebate payment. But some figures on ITIN filers. ITIN filers contribute nearly $12 billion in state and local taxes each year. Also, in 2015, ITIN filers paid $23.6 billion, that's billion with a B, in federal taxes. So these are individuals that are contributing to our communities, and the concern is if people can't access these benefits, whether it's unemployment insurance or whether it's the rebate, they're going to be in a position where they're going to be forced to continue to work and putting themselves and the community and their families at danger from exposure. So that's just some information that I wanted to share regarding some statistics. But I also, some housekeeping issues that I missed when we first started. First of all, you should have all been notified that unfortunately, due to the COVID situation, we're going to be postponing our May 4th our May 4th Immigration Summit. We were really excited to move forward and provide all the updates that are happening in the immigration realm in Southwest Florida, but unfortunately that's been postponed. We will be keeping you posted on a new date. However, there are also some other learning opportunities. Things are constantly shifting and changing, and we were joking earlier that it seems like every day there's something new, something different. So on May, and Nirupa jump in if I get May 14th, the learning community will be having a Zoom meeting from 2 to 4, and we're looking for information and topics and things that you all want to hear about. Are there things that we didn't cover today that you'd like to go into more in depth? Are there things that we didn't cover today that you want to hear about? So please make sure that you email Nirupa to RSVP or to get in touch with any topics or ideas or questions. So we've provided you with all the information. Now we really want to open it up for questions. If there's anything that any of our experts can address and answer for you, we are happy to do so. Nirupa, was there anything else that you wanted to add about the learning community?
No, thank you so much, Adonia. This was such an informative presentation, and we are hoping to continue the conversation at the May 14th meeting. And I'm sure we'll have lots more new things to talk about. I wanted to ask a question, if you guys don't mind. What do you see as the biggest issues facing immigrants in Southwest Florida right now?
Oh gosh, there's so many. I mean, I think it depends on the perspective, and Indira, I want you to jump in on this too. I think one of the really big pressing issues is we're anticipating a decision from the Supreme Court this summer on the DACA program, the Deferred Action for Childhood Arrivals, for people that came as youth. In all of the legislation that was introduced in the CARES Act, there was no provision for extensions of work authorization for individuals like our DACA recipients and temporary protected status recipients. And what concerns me about that is a lot of our DACA youth and TPS recipients are performing essential services, not just in the healthcare community, but also in food service, in hospitality. They do their economic engagement is varied and diverse as the immigrants themselves. So I think that's one big concern that I have, is we're looking at this summer potentially a negative decision from the Supreme Court that would leave nearly 800,000 people out of status. Indira, what about you?
So I have been seeing since COVID-19 a lot of folks calling who have now lost their jobs. You know, we rely here in Southwest Florida heavily on our immigrant labor pool, and with just businesses shutting down and being on hold, a lot of these folks are out of a job, and they don't have the option of finding another job or getting on unemployment benefits or tapping into any of the federal funding because they're without status. So I've definitely been hearing a lot more from the community about that. You know, so-and-so is out of a job now. How do we support our families, and what do they do? How, you know, so that's one of the biggest concerns I've been seeing in our area is you know, access to resources for undocumented immigrants who have lost their jobs. And other than community, you know, resources such as food pantries and so on, there aren't many, you know, they're completely neglected by the federal government as far as funding goes, as far as recognizing the contributions that an undocumented immigrant make to the economy, and you know, and recognizing that how this is impacting that pool of people. And I think that is really unfortunate because of how heavily here in Southwest Florida, not just Florida, but how heavily in America we rely on these folks. And here we are in a time of need, and we're saying, forget about you completely. And I think that is completely unfortunate. And but yeah, that's what I've been seeing.
I'd like to add also the challenges for migrant farm workers, as you said, not only and for low-income individuals. The challenges that I see is that they have financial difficulties already. It's going to increase. Their health, they're going to be perhaps even not going to receive their health care because of financial reasons and lack of transportation and all the barriers that they have. Also on their housing, they're not eligible if they're pending status or have no immigration status. They're not eligible to have these programs that will assist them. So their housing, if they used to live in two families living together, now we're going to have more families perhaps to help each other out. So a lot of the challenges there is living together. And then another thing is the education for the children. The families are already burdened financially and all the other areas that we've already spoken about. And are they prepared to continue with the education of their children? And all the questions that they have now will only increase. So those are some of the challenges that I see in the community that we're going to be facing with.
Another thing with COVID-19 is that we're getting updates from day to day. So at one point, immigration appointments were canceled up to, I don't know, April 9th, and then it was canceled until April 20th. It's day-to-day information is changing, and it's folks having access to this information is so crucial. I've definitely been receiving my share of clients calling, confused, wanting to know, is my court canceled? And maybe Tuesday we said, no, it's not canceled, but by Wednesday it is canceled, right? So, and these are folks that have an attorney. So I can just imagine folks that are unrepresented going through this process on their own and just being unsure as far as, my court canceled? Do I show up for my fingerprint notice? What about my interview? When does it get rescheduled? So that is why we sort of wanted to do this webinar, to get that information out there, and hopefully you folks can get it out there too, to the community. It will continue to be ever changing because we've never seen anything like this before, and not just here locally in the United States. We have consulates around the world, and interviews at those consulates are being canceled, and folks that were scheduled to leave on, I have a flight leaving to go back to do my interview on so-and-so date. So we've heard from attorney friends that, my client was just about to get on the plane to go attend his immigrant interview in Mexico, and then COVID-19 happened and everything got canceled. And, just certain things have deadlines. For example, if you have a fiance visa and you have an interview at a U.S. consulate overseas, you have to complete that interview in a particular period of time, or that fiance visa is canceled. So a lot of folks are confused. What happens? Because I cannot schedule my appointment. The consulates are closed. So I'm seeing a lot of just confusion from the immigrant community, which is definitely makes sense because, as attorneys ourselves and as practitioners, we're getting this information day by day, and we're updating and trying to update folks as best as we can, which is why I think the follow-up webinar would probably be a good idea, because by May 14th, we'll probably have a completely different landscape that we have to talk about.
Absolutely. So we do have a question from Gail. I'm sorry, Indira, I didn't mean to cut you off, but I do want to make sure that we answer this question. So Gail asked, what about childcare? And Gail, I don't know if I quite understand the question. Are you asking about access to childcare for immigrant families? If you could just elaborate on your question a little bit. And while you're doing that, I wanted to provide some takeaways. I think really important takeaways. I think there's a lot of advocacy to still do to fill in the gaps. Some really great resources for your information. The National Immigration Law Center, NILC, they are doing webinars and they have practice guides constantly on this. So it's a huge source of fantastic, accurate information. It's where I got most of the information from today. I'm not going to take credit for it. Also, protecting immigrant families. A lot of amazing information about what's happening with public charge, particularly in the time of COVID. Also, don't forget, we're in the middle of the census. One last messaging thing that's so important in the community is really encourage people to complete the census. Immigration status does not matter. There is not a question about immigration status, and the results from the census are going to be critically important for funding and representation for the next 10 years. So really encourage people. It's difficult. There's so many other distractions and things happening, but people really should make sure that they're completing the census. Gail responded, yes, and also providers. So I don't know, Sylvia, do you have any information about childcare?
Okay, so right now the child care centers are closed. The staff is helping, is trying to, and I'm referring more like to RCMA and several low child care providers that offer services to low-income individuals. They are assisting families in routing them to the resources available, but they are closed. I don't know if that answers the question as far as providers. I think that there are providers available, RCMA, and several others in the community, but they're closed right now.
Mm-hmm. And I think that's an added level. A lot of immigrants that are forced to continue or in a position where they have to continue working, and with the schools closed and children having to telelearn, what's the phrase? What do we call it nowadays? At least be at home. I think it's an additional burden and difficulty for a lot of immigrant families. So thank you, Gail, for the question. Thank you, Sylvia, for the answer. With that, I think we've covered everything. We haven't gotten any new questions. I want to thank you all for attending. I want to thank you for your questions. And as we mentioned earlier, we'll be sharing a recording of this presentation and also the PowerPoint for your information. So I hope that everybody is safe and healthy. I hope you and your families remain safe and healthy. And please reach out to Narupa with any sort of suggestions, questions, or comments for the future webinar. Thank you, guys.